Rachel Aiello with CTV News. There have been examples of providers describing situations where patients are... Rachel Aiello, CTV News. There have been examples of providers talking about instances where patients have learned that they might not have full coverage or the entire dental care program might not be quite free. So as this program continues to expand, does the government need to do more to improve the communication around this so patients going ahead know what they are and aren't going to get covered?
Yeah, it's a totally fair question. And I think that, Rachel, there are folks getting care all across the country that's deeply affordable. But it's not always free. There are some instances where there's a difference between the fees, the fee guide that we have and the fees that the professional is charging. So there can be a differential there. So I've been very clear throughout my time as minister that difference exists. It's called equal billing. And it's important that people understand that. And for the 450,000 people who've gotten care, they've been able to go in, have that conversation. They get an estimate of what the work is and what is covered. And in the vast preponderance, it is covered. It makes it deeply affordable. I was talking to somebody who had to get 4 root canals. That just is impossible to pay out of their own pocket. And there was a small cost, but compared to what that cost would have been without coverage, it would have been totally prohibitive. And what it would have meant is that person would have lost those teeth. So that's the objective of this program, is to make sure that everybody has access to affordable care. And I think one of the things that works, and one of the reasons why you've seen such an explosion of provider numbers, I mean, this is it certainly exceeds anything I could have hoped for in the first 3 months to have this level of participation, is because it's a genuine partnership. That there is a lot of times in other oral health plans, if you're an oral health provider and you're in a different community, your circumstances can be totally different in Corner Brook than they could be in downtown Winnipeg. And this plan allows you to have autonomy and recognizes that you're going to have to look at that situation. And that's part of what this provides. And I think that flexibility is a great meeting of both respecting that professional independence and making sure that care is deeply affordable.
Hi, Minister Holland. Marina von Stackelberg with CBC News. The Conservatives have put out a release about the dental care plan this morning, calling it a program riddled with chaos, backlogs, red tape, and higher costs. They do point to a survey, an online survey that the Canadian Dental Association did, which showed that nearly half of seniors that they surveyed felt that there was miscommunications, confusion over how the plan worked. So what is your response to what the Conservatives have to say here?
Well, Marina, it's rich, right? The Conservatives saying, there's confusion about this program. There's chaos about the only chaos of the program is from the Conservatives, right? The Conservatives saying there are all these problems. I've just listened to what you just asked me and put that against the reality of what I just said. This is the largest federal program ever launched. In 3 months, 450,000 people have got care. To put that in stark terms, that's 450,000 people who did not have access to care before. This is people who have teeth in their mouth as a result of this program existing. So it's a little rich to me that the Conservatives' chief argument against this program is there's confusion and misinformation when they are the originators in chief of that misinformation, right? So I would say to them, look, fine, you want to be against this program. Okay, then be clear about it and be honest about it. The Conservatives have gone from saying it doesn't exist to saying it's too confusing. If their health critic wants to debate with me on the merits of how confusing it is, welcome. You won't find him doing it, right? What's confusing about it? It's easier to use than private insurance. Providers are getting paid in less than 48 hours. I defy you to find me providers who are using the program that are having problems with the program. But I can find Conservatives who are desperate for it to not work. And I think it says something fundamental about their interest. Their interest here is a political one. And it goes back to the question that I came before, and it's an instinct I have about Canada. I think this country is interested in results. I think they're interested in seeing us lift Canadians up. I don't think they're interested in finding divisions and trying to create problems. And what I think has been able to work, and you look at the bilateral agreements that we've done with provinces and territories, we were able on aging with dignity and on working together and on primary care, we were able to get agreements with every province and every territory in a spirit of cooperation. I think if the Conservatives want to win the next election, they should have the best ideas. If they want to win the next election, they should show how they're going to make the country better than we're making the country. But trying to set fire to things that are working because they're afraid politically it's going to be bad news for them, I just think that's, well, frankly, disgusting.
Sorry, from my colleague Laura Osman, are you still consulting with the dental associations to develop the pre-authorization process?
Absolutely. So the Dental Association, I had a conversation yesterday with the head of the Canadian Dental Association. They have stated that they've received a legal opinion that they can't be either for or against the Canadian dental care plan. So they're going to have sort of a neutral position going forward. But we're working with them and all providers, so the hygienists and the denturists and certainly the dental assistants to make sure that the pre-authorization process works. You would have heard that the process we have now has been very user-friendly, and we want to continue that. We want to make it as simple as possible for providers to use. So we have working groups that are chewing through this, and we're engaging all of the different associations and are going to continue to do that. And we're on track in November to be able to deliver that pre-authorization process. That's incredibly important because we have a lot of folks with more complicated oral health needs who are going to need to access that to get the care they need.